Have you ever woken up in the morning with a mouth so dry that your tongue feels like it's stuck to the roof of your mouth? Maybe you immediately reach for a glass of water, take a few sips, and assume you simply didn't drink enough the night before. That's what most people think. But if you're over the age of 60 and this keeps happening day after day, your body may be trying to tell you something much more important. Many people accept morning dry mouth as another unavoidable part of getting older. They blame age, the weather, or sleeping with the fan on. The truth is that while aging does cause some changes in saliva production, persistent dry mouth is often linked to an underlying issue that deserves attention. In many cases, identifying the cause early can improve not only your comfort, but also your overall health. Saliva does much more than keep your mouth moist. It protects your teeth from decay, washes away harmful bacteria, helps you taste food, begins the digestion process, and makes speaking and swallowing much easier. When your mouth stays dry night after night, bacteria multiply more easily, cavities become more common, your gums become irritated, and even simple activities like eating or talking may become uncomfortable. The encouraging news is that many of the causes of morning dry mouth can be improved once you understand what's happening. Some require only small lifestyle adjustments, while others are signs that it's time to have a conversation with your healthcare provider. Let's begin with one of the most common reasons. Many people unknowingly sleep with their mouths open. It may sound harmless, but breathing through your mouth for several hours every night allows air to continuously pass over the tongue and the tissues inside the mouth, drying them out long before morning arrives. You may wake up with cracked lips, a sore throat, or a sticky feeling that doesn't disappear until you've had several drinks of water. The question is why you're breathing through your mouth in the first place. Sometimes it's due to seasonal allergies or chronic nasal congestion. Other times it can be related to a deviated nasal septum or enlarged tissues inside the nose that make breathing through the nose more difficult. For some people, especially older adults, mouth breathing may also be associated with sleep apnea, a condition where breathing repeatedly stops and starts during sleep. If your dry mouth is accompanied by loud snoring, frequent awakenings, daytime sleepiness, or if someone has noticed pauses in your breathing while you sleep, it's worth discussing these symptoms with your doctor. Treating sleep apnea doesn't just improve dry mouth, it can also improve energy levels, reduce strain on the heart, and help you sleep more deeply. Simple changes may help if mouth breathing is the main cause. Sleeping on your side instead of your back often reduces mouth breathing. Keeping your bedroom at a comfortable humidity level may also prevent excessive drying during the night. If nasal congestion is persistent, identifying and treating the underlying cause can make a significant difference. Another reason many older adults experience dry mouth has nothing to do with bedtime. It begins much earlier in the day. As we age, our sense of thirst gradually becomes less reliable. Many people simply don't feel thirsty until they're already mildly dehydrated. Some intentionally avoid drinking water during the afternoon or evening because they don't want to wake up during the night to use the bathroom. While that may reduce nighttime trips, it also means the body begins the night with less fluid than it needs. When you sleep for 7 or 8 hours without drinking anything, that mild dehydration becomes even more noticeable by morning. Drinking a large glass of water just before bed usually doesn't solve the problem because much of it is quickly processed by the kidneys instead of gradually supporting hydration throughout the night. A better approach is to spread fluid intake evenly throughout the day. Drinking water with breakfast, lunch, and throughout the afternoon allows your body to maintain healthier hydration levels before bedtime. Foods with high water content, such as cucumbers, oranges, berries, tomatoes, and soups, also contribute to daily hydration. Another commonly overlooked cause involves nutrition. Your salivary glands rely on vitamins and minerals to function properly. If your body doesn't have enough of certain nutrients, saliva production may gradually decrease. Vitamin B12 is especially important because it supports healthy nerves, including those involved in stimulating saliva production. Zinc also plays an important role in maintaining healthy tissues inside the mouth. As people grow older, absorbing vitamin B12 from food becomes more difficult. Even individuals who eat a balanced diet may eventually develop low levels without realizing it. Symptoms can include fatigue, tingling in the hands or feet, balance problems, memory difficulties, and changes inside the mouth. If blood tests show a deficiency, your healthcare provider may recommend dietary changes or supplements. Good food sources include fish, eggs, dairy products, lean meats, beans, nuts, and fortified cereals. Rather than taking supplements on your own, it's always better to discuss them with your doctor so they match your individual needs. Blood sugar is another important piece of the puzzle. One of the earliest signs of elevated blood sugar can be excessive thirst and dry mouth. When blood glucose rises above normal levels, the kidneys work harder to remove the extra sugar through urine. As more water leaves the body, dehydration develops, often causing persistent dry mouth. If you've also noticed frequent urination, unusual fatigue, blurred vision, slower wound healing, or increased thirst throughout the day, these symptoms deserve medical evaluation. A simple blood test can determine whether your blood sugar is within a healthy range. Many people are surprised to learn they have prediabetes or type 2 diabetes because symptoms often develop gradually. Catching these conditions early gives you the best opportunity to manage them through healthy eating, regular physical activity, weight management, and medications if necessary. Sometimes the cause isn't related to hydration, nutrition, or blood sugar at all. Instead, the immune system itself may be involved. Certain autoimmune conditions can affect the glands responsible for producing saliva and tears. One of the best-known examples is Sjogrens syndrome. In this condition, the immune system mistakenly attacks healthy moisture-producing glands, leading to chronic dry mouth and dry eyes. People with this condition often describe their eyes as feeling gritty or irritated, almost as though sand is trapped beneath the eyelids. Swallowing dry foods may become difficult without taking frequent sips of water. Some people also experience joint discomfort, fatigue, or swollen salivary glands. Because these symptoms can develop slowly over several years, many people assume they're simply part of aging. If dry mouth consistently occurs alongside dry eyes or persistent fatigue, bringing these symptoms to your healthcare provider's attention is important. Additional testing may help determine whether an autoimmune condition is contributing. Another factor that's often overlooked involves the nervous system. Saliva production isn't automatic. It depends on a complex network of nerves constantly sending signals to the salivary glands. Certain neurological conditions or damage affecting these nerves can reduce saliva production over time. This doesn't mean everyone with dry mouth has a neurological disorder. Far from it. However, if dry mouth develops together with tremors, significant changes in balance, problems with smell, constipation, or other unexplained neurological symptoms, discussing the complete picture with your physician is worthwhile. Looking at symptoms together rather than individually often helps identify health conditions much earlier. Finally, we come to what is perhaps the most common reason of all, especially among adults over 60: medications. Many prescription and over-the-counter medicines reduce saliva production as a side effect. Because older adults often take several medications at the same time, the effects can add up, making dry mouth increasingly noticeable over the years. Antihistamines used for allergies, certain antidepressants, medications for high blood pressure, medicines for overactive bladder, muscle relaxants, sleep aids, and some pain medications are only a few examples. Even products purchased without a prescription may contribute without people realizing it. The important point isn't to stop taking your medication. Never discontinue a prescribed medicine without speaking to the healthcare professional who prescribed it. Instead, review your complete medication list with your doctor or pharmacist. Sometimes another medication with fewer drying effects is available, or a small adjustment can reduce symptoms while still effectively treating the underlying condition. Many people are surprised that after a medication review, their dry mouth improves significantly without compromising their medical care. One of the most important things to remember is that dry mouth itself is not a disease. It is a symptom. Think of it as your body's way of asking you to pay attention. Sometimes the cause is simple and easily corrected. Other times, it may be the first clue that something deeper deserves a closer look. The sooner you identify the reason, the sooner you can take steps to protect not only your mouth, but your overall health. Fortunately, there are several practical habits that can make a noticeable difference, often within just a few days. Start by making hydration a priority throughout the day, rather than trying to catch up at night. Instead of drinking most of your water in the evening, spread it evenly from morning until late afternoon. This gives your body time to absorb and use the fluids effectively, while reducing the chances of waking up several times during the night to use the bathroom. Pay attention to what you're drinking as well. Water should remain your primary beverage, but you should also be aware that drinks containing large amounts of caffeine or alcohol can contribute to dehydration in some people. That doesn't necessarily mean you have to eliminate coffee altogether, but balancing it with adequate water intake can help. If you wear dentures, make sure they fit properly and are cleaned regularly. Poorly fitting dentures can irritate the tissues inside the mouth, making dryness feel even worse. Your dentist can determine whether adjustments are needed. Good oral hygiene becomes even more important when saliva production decreases. Brush gently twice each day with a fluoride toothpaste, floss daily if possible, and schedule regular dental checkups. Saliva normally helps protect your teeth against decay. When saliva is reduced, cavities can develop much faster than many people expect. You may also find relief by chewing sugar-free gum or sucking on sugar-free lozenges, particularly those sweetened with xylitol. The simple act of chewing stimulates the salivary glands and encourages them to produce more moisture naturally. Just be sure to avoid products containing large amounts of sugar, since a dry mouth already increases the risk of tooth decay. Many people overlook the effect that the environment has on their symptoms. If the air inside your bedroom is very dry, especially during winter months or in homes with constant air conditioning, using a humidifier may help maintain moisture in the air while you sleep. Some people notice improvement after only a few nights. If you frequently breathe through your mouth because your nose feels blocked, don't ignore it. Persistent nasal congestion has many possible causes, including allergies, chronic sinus inflammation, or structural problems. Treating the underlying issue often reduces dry mouth without needing any special mouth products. You should also take a careful look at your daily medications. Make a complete list of everything you take, including prescription medicines, vitamins, herbal supplements, and over-the-counter products. Bring that list to your next doctor's appointment or pharmacy consultation. Many people are surprised to discover that several different medications are each contributing a small amount to the problem, and together they create significant dryness. Sometimes a safer alternative or a different dosing schedule can reduce symptoms considerably. If you use an over-the-counter sleep aid every night, especially one containing older antihistamines, ask your healthcare provider whether there are other options that may be more appropriate for long-term use. Never stop a prescribed medication on your own, but never hesitate to ask whether another choice might work just as well with fewer side effects. There are also situations where dry mouth should never be ignored. If you suddenly develop severe dry mouth along with excessive thirst, confusion, dizziness, or signs of dehydration, seek medical attention promptly. These symptoms may indicate a more serious medical problem that requires immediate evaluation. If your dry mouth is accompanied by painful swollen glands, difficulty swallowing, persistent sores that don't heal, unexplained weight loss, or blood in your saliva, don't wait to see if the symptoms disappear on their own. Make an appointment with your healthcare provider as soon as possible. Likewise, if you have dry mouth together with constantly dry eyes, ongoing joint pain, or overwhelming fatigue, mention all of these symptoms during the same visit. They may seem unrelated, but together they can provide important clues that help your doctor reach the correct diagnosis. Remember that your mouth often reflects what's happening throughout the rest of your body. Dentists are sometimes the first healthcare professionals to notice signs of nutritional deficiencies, diabetes, autoimmune disorders, or medication-related problems simply by examining the tissues inside the mouth. That's one more reason regular dental visits remain important throughout life. Many people spend months or even years believing that waking up with a dry mouth is just another inconvenience of getting older. It doesn't have to be. In many cases, identifying the cause leads to meaningful improvement, better sleep, greater comfort, healthier teeth, and a better quality of life. The key message isn't to become worried every time your mouth feels dry. The goal is to become aware. Pay attention to patterns. Notice whether the symptom happens occasionally or every morning. Think about whether it's accompanied by snoring, frequent urination, dry eyes, fatigue, or recent medication changes. Small details often provide the biggest clues. If you've been waking up with a dry mouth for weeks or months, don't simply keep a glass of water beside your bed and hope the problem disappears. Instead, treat it as an opportunity to learn more about your health. A simple conversation with your doctor or dentist could reveal something that is both treatable and important. Our bodies are remarkably good at sending early warning signals. The challenge is that these signals are often quiet. They don't usually arrive with flashing lights or severe pain. Instead, they appear as subtle changes that are easy to dismiss. A little more fatigue, a little more thirst, waking up with a dry mouth every morning. When we learn to recognize those signals early, we give ourselves the best chance to prevent bigger problems later. Healthy aging isn't about ignoring symptoms or accepting discomfort as normal. It's about listening to your body, making informed choices, and taking action before small issues become larger ones. So tomorrow morning, if you wake up with a dry mouth again, don't simply assume it's because you forgot to drink enough water. Take a moment to consider what your body might be trying to tell you. It could be as simple as changing a daily habit, adjusting a medication with your doctor's guidance, improving your hydration, or scheduling a routine checkup. Whatever the cause, paying attention today could make a meaningful difference to your health tomorrow. If this information has helped you better understand what may be causing your morning dry mouth, consider sharing it with someone you care about. Many older adults experience this symptom without realizing it can sometimes point to an underlying issue that's worth discussing with a healthcare professional. Staying informed, asking questions, and taking small but consistent steps toward better health can have a lasting impact. Your body has spent a lifetime taking care of you. Now is the perfect time to return the favor by listening carefully to the messages it sends every day.